Good afternoon and welcome to the August 6th Community Update. My name is Stacie Wood and I serve as a Public Information Officer here in the Emergency Operations Center. This Community Update is available in Spanish on the Buncombe County Health and Human Services Facebook page, and that can be found on Facebook at BCHHS. And all of our community updates can be found on the Buncombe County YouTube channel or on Facebook at Buncombe.gov. Today's updates will be provided by Stacie Saunders, Buncombe County Public Health Director, Dr. Jennifer Mullendore, Buncombe County Medical Director, Brownie Newman, Chair of the Buncombe County Board of Commissioners, and Fletcher Tove, Buncombe County Public Health Preparedness Director. And we will get started with an update from Stacie Saunders.
Thank you for tuning in today and sharing your time with us. I'm Stacie Turpin Saunders, your Health Director for Buncombe County. Thank you for the opportunity to serve you and our community. I come to Buncombe with almost 13 years of public health experience, and prior to that, I have worked in both private and public health systems. For the last 6 years, I have served as the Health Director for Alamance County, where I led the local health department and the coordinated community COVID-19 response. I look forward to the opportunity to share my knowledge, expertise, and experience with our Buncombe County response, and I look forward to learning from our own leaders and our community about their journey in this pandemic. Public health's fundamental roles are to prevent, protect, and promote. These core functions are integrated and woven into every program, every service, every response, including our COVID-19 response. We prevent disease through identifying confirmed cases and those with a risk of exposure and properly isolating and quarantining them so that others in our community are not exposed. We protect our community through providing access to testing sites where you can receive testing if you are exhibiting symptoms or may have been exposed to COVID-19, helping us to identify new cases so that we may protect others by reducing potential exposure. And we promote strategies that aim to stop the spread of COVID-19. This includes mitigation and infection control measures that further prevent the spread and protect you, the folks that live, work, learn, and grow right here in this community. Please remember to wear your cloth face covering. You protect me, and I protect you when we wear our face coverings or masks properly and consistently around others, and especially in places where we are unable to have 6 feet between you and others. Remember to wash your hands often to reduce the spread of virus, and wait 6 feet apart from those outside of your household. In the coming days and beginning next week, you'll be seeing more of me as we share information about COVID-19, especially here at these community updates. I look forward to serving as the Public Health Director here in Buncombe County, and I also look forward to advancing health, safety, and opportunity in our communities. Before I turn it over to Dr. Jennifer Mullendore, I want to recognize and acknowledge her hard work and dedication in serving as our interim health director. I also want to thank Fletcher Tove for his focus on mitigation strategies and protecting public health during this pandemic. I feel very fortunate to be able to draw upon their knowledge and deep experience here in Buncombe County, and I look forward to continuing our work together in public health and in this COVID-19 response. And now, Dr. Mullendore will provide an update on case counts and trends in Buncombe County. Thank you again.
Good afternoon. Over the past week, we have seen an improvement in Buncombe County in some important COVID-19 data and trends. First, we have seen a decrease in the number of new cases of COVID-19 reported in county residents daily. Over the last week, an average of 30 new cases have been reported daily to Buncombe County Public Health, down slightly from an average of 41 new cases reported to us each day during the prior week. This has occurred at the same time that there has been significant improvement in the time it takes for lab results to return. As of noon today, there have been 1,776 lab-confirmed cases of COVID-19 in Buncombe County residents. Sadly, 46 Buncombe County residents have died as a result of their COVID-19 infections. 39 of those individuals were residents of long-term care facilities. Another trend we have been following has been the percent of tests that come back positive for COVID-19. In North Carolina as a whole at this time, 9% of COVID-19 tests performed are coming back positive. This percentage for the state has ranged from 7 to 10% over the past month. In Buncombe County, during most of the month of July, 5% of tests came back positive for COVID-19, which was up from 2 to 3% in June. Last week, this percent decreased slightly to 4.5% of tests in Buncombe County residents coming back positive for COVID-19. This indicates that there has been a decrease in spread of COVID-19 in our community. While we are pleased to see improvement in these numbers and trends, we must not become complacent and let our guard down. Now is the time to dig down and continue in our efforts to slow and stop the spread of COVID-19 in our communities. Please do everything you can to limit your exposure to others outside your household and practice the 3 W's when you must be out in public around others. Wear a face covering, wait 6 feet apart from others, and wash your hands often. Our public health staff are working hard on case investigation, contact tracing, and answering questions from the public, businesses, and schools about COVID-19. We encourage individuals and businesses to look at the guidance on the CDC, state, and Buncombe Ready websites for answers to your questions. And then if you don't find your answer there, give us a call. If you meet any of the following criteria, we are still recommending that you get tested for COVID-19. If you have symptoms, including fever, chills, cough, shortness of breath, fatigue, muscle or body aches, headache, sore throat, loss of taste or smell, nasal congestion, runny nose, nausea, vomiting, or diarrhea. If you are a close contact to someone with COVID-19, whether or not you have symptoms. And if you are a member of a high-risk group and think you have been exposed to COVID-19, whether or not you have symptoms. And this includes people who live and work in high-risk settings like long-term care facilities, homeless shelters, or migrant farm worker camps, people over the age of 65, or people of any age with underlying health conditions, persons from historically marginalized populations, meaning Black and Indigenous people and people of color, healthcare workers or first responders, and frontline and essential workers in settings where it's difficult to maintain your physical distance. Remember that repeat testing is not recommended unless you are an employee in a long-term care facility or you've been directed to be retested by a healthcare provider or public health nurse, or if your situation changes. If you do not have a healthcare provider who offers testing for COVID-19 and you meet criteria to be tested, you can use the state's Find My Testing Place website to find COVID testing near you. There are many places in our county offering testing for COVID-19. Primary care providers, community health centers, urgent cares, hospital systems, and pharmacies. If you do not have health insurance and are worried about the cost of testing, we encourage you to contact your closest federally qualified health center or one of our local clinics that offers discounted fees or programs that cover the cost of testing and your visit. These would include Western North Carolina Community Health Services, Blue Ridge Health, Appalachian Mountain Community Health Services, Mercy Urgent Care, Range Urgent Care, and Mayheck Family Health Center at Biltmore. You now can also schedule an appointment at one of the county's community testing sites. Starting this Sunday, August 9th, Buncombe County's COVID-19 community testing resumes for anyone who lives, works, or learns in Buncombe County and meets the criteria for testing. In a major change from the previous testing sites, people will now need to be registered and scheduled for testing in advance. This new process allows people to schedule their testing time so that they avoid long wait times at the testing site. We have partnered with a local lab to ensure that test results will return within 48 hours after specimens get to the lab. The sites remain designed as drive-through sites, but those who walk up or take the bus will have access to the testing site. So here are the steps to get tested at one of Buncombe County's community testing sites. First, complete the Buncombe County self-checker online or over the phone to make sure that you should be tested. The Buncombe County self-checker can be found online at buncombeready.org. If you need help completing the self-checker, you can call the Ready team at 828-419-0095 from 8:30 in the morning until 5 p.m., Monday through Friday. Once you complete the self-checker online or over the phone and get registered, and your answers indicate that you should be tested, a representative will contact you over the phone to schedule a date and time for testing. Then you show up at the testing site on your scheduled date and time and get your test. Community testing sites will remain available on Tuesdays, Thursdays, and Sundays in the same locations as before. Sundays at AB Tech, Tuesdays at the Ingalls and Swannanoa, and Thursdays at the Buncombe County Sports Park. Cost is not a barrier to testing at these sites. There is no out-of-pocket cost to the testing. If you have insurance, it will be billed to cover the cost of the test. Spanish medical interpreters will be at the testing sites. More information about COVID-19 testing in Buncombe County can be found at buncombeready.org. The number one action that we can all take right now is to prevent COVID from spreading in the first place. Let's keep up the good work to continue driving our case numbers and community spread down. You can do this by wearing your face covering, staying at home as much as possible, and not participating in activities that put you and your family at risk. Again, we're providing this information to you to help you take actions to protect yourself and your health. Please do what you can to stay safe and keep others safe. Thank you. I'll now turn it over to Commission Chair Newman.
Thank you, Dr. Mullendore. Good afternoon. My name is Brownie Newman. I'm the chairman of the Buncombe County Commission. Throughout this pandemic, we have sought guidance from our county health officials to inform decision-making on our response to the pandemic. Buncombe County has been proactive in our response to this health threat, being one of the first counties in the state to declare a local health emergency and stay safe, stay home policy. We also issued a requirement to wear masks and face coverings weeks before the state also adopted this policy. As a result of the people of our community taking personal responsibility for their actions, Buncombe County has had a lower level of transmission of COVID-19 than most other metropolitan areas in North Carolina and the Southeast. However, since the phase 2 reopening has started in North Carolina, we have seen a significant increase in cases in Buncombe County and an increase in the number of people becoming so seriously ill that they have to be hospitalized. At our commission meeting this week, we heard from our health officials about strategies to reduce the spread of COVID-19. One proposal was to require restaurants to stop serving alcohol at 9 or 10 p.m., as some restaurants begin to operate more like bars in the late evening with staff and patrons not wearing masks and not respecting social distancing requirements. Another approach is to increase enforcement activities. To date, our law enforcement staff have focused on education and encouragement to increase compliance with safety protocols, and we will continue those efforts. However, we also see that for some businesses that are flagrantly violating these public safety orders, additional enforcement actions may be necessary. Over this weekend and the coming week, there will be a cooperative effort between our health department, law enforcement, and the fire marshal's office to step up enforcement, especially within restaurants that operate later in the evenings. Our hope is that these enforcement efforts will improve compliance with the public safety policies, so there will not be a need to increase regulations that impact our local businesses and restaurants that have already faced such a challenging year. However, our public health staff will report back next week. If there is widespread disregard for the public safety policies, despite increased enforcement efforts, they may not have a choice but to recommend restricting the sale of alcohol in restaurants later in the evenings, as some other North Carolina jurisdictions have already done. In closing, I want to reiterate my appreciation to everyone in the community for their efforts to help us get through this uniquely challenging time. The good news is we know how to defeat this transmissible illness. If we all do our parts, we will get through this sooner, with fewer people getting sick, and be able to further restore our economy and our schools. Thank you.
Good afternoon. I'm Fletch, Tove, Public Health and Emergency Preparedness Director. Yesterday, based on statewide data trends, Governor Cooper issued Executive Order number 155, which extends Phase 2 restrictions in North Carolina for another 5 weeks until September 11th. Buncombe County will fully comply with Executive Order number 155. However, I do want to address 2 areas of concern in which our community is not putting forth our best effort to prevent the spread of COVID-19. These areas of concern are gyms and also restaurants and breweries. Per Executive Order number 141, which, if you can recall, is what initially put us into Phase 2 of reopening, gyms and indoor exercise facilities are mandated to remain closed. There is an allowance that if a client has documentation from a healthcare provider or medical professional that they require physical therapy or exercise, that the gym may allow them to use their facilities. Gyms and gym owners are required to verify that these clients have signed letters from their doctor for this exception. Letters from personal trainers or health coaches are not sufficient. They must be signed letters from medical professionals. As for restaurants and breweries, earlier this week, Public Health proposed setting more stringent restrictions on alcoholic beverage sales than the governor's time of 11 p.m. While the majority of our local restaurants are complying with guidance, we have received reports of several restaurants who are not in compliance with state and local orders and are essentially operating as bars at night, which are expressly closed due to the governor's orders. Restaurants and breweries, if they do not follow this guidance, have the potential to become an ideal setting for the transmission of COVID-19. The guidance for restaurants and breweries to require parties to keep 6 feet of distance is for good reason. And it has become crystal clear that as people drink, physical distancing behaviors break down. While we are not putting further restrictions on the sale of alcohol at restaurants in our current order, starting this weekend, we are forming a joint response team to spot check restaurants and breweries for compliance with the orders. This team will consist of members of public health, the Sheriff's Department and Asheville Police Department, county and city fire marshals, alcohol law enforcement, the ALE, and Asheville Independent Restaurants, AIR. Over the next week, this team will spot check area restaurants and gyms for compliance and will issue warnings and citations. Based on the observations of this response team, we will make the determination by next Thursday whether or not to recommend that Buncombe County put increased restrictions on alcohol sales in the local orders. This is an opportunity for the restaurants who have been violating orders to fall into compliance, and also for the restaurants and service industry staff who are working very hard and making sacrifices to do the right thing for the community to put pressure on these non-compliant restaurants so that a few violators do not end up causing sweeping restrictions for the entire industry. As a reminder, these are the current requirements for restaurants that this response team will be spot checking. The requirements come from Executive Orders number 141 and 153, as well as the North Carolina Department of Health and Human Services interim guidance for restaurants. The emergency maximum capacity must be posted conspicuously, and the restaurant must not exceed that newly defined emergency maximum capacity. Restaurants cannot seat more than 10 customers at a table unless those customers are of the same family. Front of house staff must wear a face covering at all times. Customers, when not seated at their table, are required to wear a mask. 6 feet spacing must be designated at all high traffic areas. This may include checkout registers and also outside the restaurant or brewery as people are waiting to come inside. The sale of alcoholic beverages for on-site consumption must end at 11 p.m. per the governor's order. Failure to post signage at the entrance regarding the 3 W's of wear, wait, and wash at the entrance, or failure to post signage regarding COVID symptoms at the entrance are also violations, as is the failure to conduct a daily symptom screening of staff. Resources for those signage requirements and the screening can all be found at Buncombe County or buncombeready.org. To everyone who continues to take the state and local guidance seriously, we thank you. To all the restaurant owners and staff who are working very hard to make their spaces a safe place for the community, we thank you too. We have some big hurdles ahead of us as our schools are set to reopen, fall approaches, and we step into flu season. There is still a risk of overwhelming our healthcare systems, and it takes everyone working together to prevent that and safeguard our community. Thank you, and as always, stay smart, stay safe, and let's take this step by step.
Thank you to all of our presenters today, and thank you for tuning in to the community update. We will be back with the next community update next Thursday, August 13th at 3 p.m. We are reducing our community updates starting next week to just one community update per week. There will no longer be a press release sent out on Mondays. unless there is something notable that happens over the weekend that we need to update our community on. So again, we'll be back next Thursday at 3 p.m. for the next community update. Thank you and have a safe and healthy weekend.